which we'll email out after today's event. An extra thanks today to the Wisconsin Hospital Association, today's featured sponsor. WHA is a longtime and very generous supporter of Wisconsin Health News. We are grateful for all of their support. Here to say a few words is CEO Eric Borgerding.
Hey, good afternoon, everyone, and thanks a lot, Tim, for the opportunity. I'm Eric Borgerding, and I have the real honor of serving as the president and CEO of the Wisconsin Hospital Association. WHA is proud to be the voice of all Wisconsin's great hospitals and health systems, rural, urban, independent, and those that are part of systems. And WHA's primary purpose, of course, is advocacy, and it's a role we increasingly broadly define, and I'm very proud of the exceptional team we have to do that. We invest a lot of time and effort into understanding the challenges facing healthcare and developing public policy to address those challenges and working with our partners inside and outside the Capitol to advance proactive ideas and solutions. COVID, of course, has dominated much of this public policy related advocacy work for us, certainly over the past 14 months. Probably the most recent example of that would be the enactment of, and now implementation, two different things, of AB 148, now 2021, I think Act 10. And now, of course, the state budget and trying to deftly and productively navigate
This is what it looks like.
policy and politics of all the above. In fact, tomorrow, as Tim and I were discussing, WHA will be hosting our Advocacy Day program. And while we had to cancel last year, this year we'll again welcome about 1,000 people virtually tuning in to the program, and then hundreds of them becoming virtual citizen lobbyists and sort of virtually going to the Capitol to speak with their legislators. It really is kind of exciting, if you will, to see advocacy sort of in action and people still petitioning their government and wanting to, whether it be even virtually during a pandemic. It's fantastic. And like many of our counterparts in Wisconsin, WHA has also redefined advocacy over the past many months, shifting gears to engaging in activities that aren't, like straight up public policy or lobbying, yet really advocacy nonetheless. Some examples of that include interfacing with government and private sector leaders to help our members secure adequate PPE, help them stand up, resource the capacity to administer hundreds of COVID tests and over 1.5 million now vaccines. Aspirus, great example of that, and do that for the patients in their communities. And more outwardly, perhaps, WHA joining with other groups to stand up and operate the Stop the COVID Spread Coalition, which has really had a great impact, or even the WHA Information Center's COVID dashboard, which as of yesterday had just shy of 1 million total hits. This has been really important to provide a lot of information to Wisconsin. I guess my point is, like many of our Wisconsin counterparts, we've pivoted our advocacy efforts to do everything we can to help the state and its citizens make decisions, and to help make sure our members, with and without legislation or regulatory relief, make sure they can do what they do best, and that's deliver really exceptional healthcare, including during a pandemic. And one of the many great examples of that is Tim, your featured speaker today, Matt Heywood, leader of Aspirus and also one of our longtime board members. So thanks, Tim, for this opportunity to say maybe more than a few words. And I also want to express our appreciation to Wisconsin Health News, to you and Sean, and all you both do to keep us all informed. As you mentioned earlier, we're very proud to be longtime sponsors, and I'm really looking forward to the program today. So thanks again, Tim, for the opportunity.
Thank you, Eric, so much. Thanks for all the generous support of WHA. Thanks for the kind words. And thanks again, Matt, for being here today. Aspirus is poised to more than double the number of Wisconsin hospitals It has through a deal it announced earlier this year with Ascension. The health system is set to add 7 hospitals, 21 physician clinics, and air and ground medical transport in North and Central Wisconsin, making it one of the state's largest health systems. This expansion comes as Aspirus and other health systems across the state are still responding to the now over a year-long COVID-19 pandemic as cases start to tick back up across the state. So Matt, hoping to talk about all of this and a little more. Our time is always limited, so I'm gonna dive right into the questions. COVID-19 cases are ticking back up again, as are hospitalizations. As of yesterday, there were 304 COVID-19 patients in Wisconsin hospitals, 63 more than a week ago. What's the situation right now at Aspirus hospitals? What type of increase in COVID-19 patients are you seeing right now?
Well, first, I want to thank everybody for giving me the opportunity to speak with you today and be part of this discussion. Aspirus is, I believe, like many of the other members within Wisconsin, seeing a slight uptick, but not a dramatic uptick at this point. We saw that we plateaued at around 10 patients or so a day in the ICU and a few others that are in the non-ICU care. And that is probably like we were way back in September before the real big surge Wisconsin had. So it's one of those things where it's percolating, but it's not exponentially growing. But as we know with this disease, it can rapidly grow and exponentially grow. So we are keeping a close eye on it to see if things start to escalate.
So as you look at the COVID numbers in neighboring Michigan, and I know Aspirus has some hospitals in the Upper Peninsula, which of course really should be part of Wisconsin, but that's for another webinar. But you see these numbers in Michigan approaching its fall surge. You see cases here start to increase, as you said, just maybe a slight uptick at this point in terms of hospitalization. But how are you concerned? How concerned are you that another surge could be building here in Wisconsin?
We believe that there's 3 possible scenarios, and we believe strongly enough that this is one of the 3, that it could surge back to some of the levels that we've seen, especially given that it's not just happening in Michigan, but you're seeing it start to happen in Minnesota and a few other Midwestern states. And if you look across the country, the Midwest seems to be where these surges are starting to happen right now. And what we've learned from the previous pandemic surges are they do seem to be somewhat regional based. So we are definitely concerned. We think that we want to continue to ask people, even during this efforts to get vaccinated, to make sure they can get vaccinated, to please get vaccinated, but also to practice social safe distancing, masking, and hand washing still. We're not out of the woods yet until we can get herd immunity.
You were, like other hospitals across the state, but especially in the region that your hospitals are in central and northern Wisconsin, pretty close to the brink last fall. Several hospitals got pretty close to filling up. What are some of the lessons you learned last fall that you are applying now, or you could see needing to apply if another surge happens now?
One of the things we've learned is we have to think creatively. A second thing we've learned is we have to look at how we can use our systemization. And we have elements that go all the way from our health plan to our primary care to our post-acute care side and our home health. And we have to think nimbly and quickly and empower our people. We really cared for a dramatically large number of patients, almost 230 patients during the peak. And almost half of those were in the home, using our home care and hospice capabilities. So we are really ready to continue that if we need to, and if the surge happens again, to use those 3 same elements to make sure we can handle what our communities need.
So as you mentioned, Matt, we're kind of in a race right now to get enough people vaccinated before these more infectious variants, which is driving these increasing numbers in the Midwest and other parts of the country, before these variants can take hold. Overall, how are vaccinations going in your health system and the region of the state that your hospitals are in?
I think Wisconsin, after a little bit of a start that was somewhat challenging, and we weren't alone, many of the states in the country was having a challenge, has really picked up the pace, and we have a really good vaccination program in place. We're vaccinating our staff, and we're getting our communities vaccinated. What we are seeing, though, and you're going to start to probably see, and we'll see across the country, is that there is going to be a point where those who want to be vaccinated will be vaccinated. And then we'll find out how many people are not necessarily interested in at this point in being vaccinated. And if you look at the flu, we usually have a national average of about 50% vaccination for the flu. Now, given that the COVID vaccines are under emergency approval, given some people's concern, I think to shoot for 50 to 60% vaccination rate across the country is going to be probably a tough stretch. And then we're going to have a little bit of the individuals who've gotten sick having their own immunity. But herd immunity is going to be a little bit of a challenge unless we can get more people to feel comfortable taking the vaccine. Here at Aspirus, we have worked hard to make sure our employees are getting vaccinated. We're setting an example, and we're working hard to educate our communities about the efficacy of the vaccine and getting vaccinated. But it's not going to be an easy answer given some of those pieces of information I just shared.
And as you know, a lot of experts have said we need to get to at least 80% of the population to potentially achieve herd immunity. So if we're only going to get maybe not even get to that 50 to 60%, that you know, there are some that believe that could prolong the duration of the severity of this pandemic. How, looking at your health system specifically, about how much of your frontline workers have gotten the COVID-19 vaccine so far?
We're in the 60 to 70% range, and we're continuously ticking up as people are starting to get more comfortable with it. And we're working to continue to further educate and role model the need to do it. So I think we're going to have a higher uptake than you would see in the national population, given that people are healthcare workers and understand it and can be supportive of it a little bit more than the general population. But we can be role models to hopefully get the population comfortable.
Do you anticipate at any point requiring that your staff get vaccinated? I mean, do you think that's something that healthcare organizations or other employers should consider?
We thought about that, and I had to ask myself, forgetting about the legal aspect, forgetting about the politics, how would individuals feel with a mandate versus us educating them more? And what would be the right path and course of action, especially given that this is an emergency approved vaccine? I think that's a very important statement, emergency approved vaccine. And we just heard about J&J having some issues and a couple other vaccines having some issues. I do think that there are concerns that people have, and they have the right to have those concerns. So mandating something that is emergency approved, as well as having some other vaccines with some challenges, I do think that would not probably be the best course of action to win the hearts and minds of people. So we're going to work on education. We're going to work on role modeling and helping people see it to be the right thing to do as our way of going forward and doing it. And I believe that's important because you can't mandate it for the whole country. It's going to be a very tough thing to do. So the only way to do it is to follow those same principles for the country. So if we can do some of those internally, we can then help use those for our communities to help role model the way.
So I want to shift gears a little bit and talk about your agreement to take over 7 hospitals from Ascension. And just wonder if you could provide any update on that. I mean, is that still set to be finalized this summer?
Yes, we're looking to have it finalized this summer. We still have regulatory and church approval processes that we're going through, but it's looking positive and we're real excited about meeting that summer timeline.
How did this arrangement come to be? I mean, who came to which party came to which party, and you know, why is this something that you're moving forward with?
When you look at rural healthcare is in Wisconsin has some really great rural healthcare. It is not an easy type of care to provide. You have limited resources, you have large geographic distances, and you have to think about how you deliver care in different ways. Just like if you were in a city, you are going to have different ways you're going to have to deliver care. And when we were working with Ascension, we were talking about how we can continue to further, for our communities, solid, strong, consistent rural health care throughout northern Wisconsin. And as we started having those conversations off and on, we had various different ideas of how we could partner. And after a while, we came to the conclusion that the best, most effective way for us to provide the highest level of care in our markets was for us to look at an integrated option, and Aspirus would be acquiring those hospitals, staff, and physicians. And the reason that we think that it's beneficial for us and for Ascension and our communities is because we can provide a tighter, more integrated type of care for our communities, and we can do it more effectively than if we try to do it as two separate parties. And I think that really came to a very clear understanding after we went through the pandemic, and we realized how a tight integrated network could provide a lot of different solutions very rapidly. So I think this is going to be great for the communities of northern Wisconsin.
So you're making a big bet on hospitals at a time when some patients are still cautious to come back. And even before COVID-19, more care was moving to outpatient settings. Well, why do you think it is? I mean, and you've kind of expounded on this, but maybe you could expound a little bit more. But why do you think it was the right move to more than double your hospital footprint?
Well, first and foremost, when you look at Aspirus as we're designed today, we're almost 70% or more outpatient, not hospital-based business. So we are really designed to be an outpatient organization. So when you look at a lot of these hospitals that we're acquiring, they're really very small organizations that are mainly outpatient centers with some inpatient capacity and ability to serve emergency-based needs for the very local communities. So really, we look at a number of these organizations we're purchasing as hospitals, but they're heavily outpatient-centered organizations with a couple PPS hospitals that are more inpatient-centered. But when you look at the total scope of the organization that we are integrating, a large segment of their business is actually an outpatient. So really consider this more of an outpatient with some hospital-based inpatient service as the perspective of which we're looking at it.
So as a result of this agreement, there will be one less major system in central and northern Wisconsin as you take over these hospitals from Ascension. How do you respond to criticism that hospital consolidation can lead to increased costs?
First, I would say when you look at the original northern market when I got here about 8 years ago, it really was a two-hospital system market. It was Ministry and Marshfield working together in a collaborative model, but it was basically them working together in a very contractual integrated relationship versus or competing with Aspirus. I just think that all we've done is kind of moved around the deck chairs and still have two highly integrated, very effective systems in northern Wisconsin. So I don't think that perspective has changed. As for cost of healthcare, how does having competition help? I think that always helps. But what drives Aspirus is not competition in keeping costs down, but an understanding that our patients, our communities cannot continue to have 6-7% price increases, that we're going to have to figure out how we deliver care differently because that model will not work. And that's what's driving what Aspirus is doing, not necessarily having to have competition to do that. And since we've been here, we worked very hard to try to lower our cost structure and integrate our system while still keeping jobs local wherever we can and keeping businesses in these communities. And we've actually cut $30 to $40 million every year of cost out of our system by working tighter and stronger and more effectively as a team.
What role will Aspirus Health Plan play in this new, larger organization? Is there going to be a larger health plan because of this? I mean, what's the future of Aspirus Health Plan?
Aspirus Health Plan is going to hopefully grow. We don't look at it to grow, but we look at it to get bigger, get more effective, more efficient. But really what it's doing is it's helping us hold ourselves accountable to keeping our costs down. Because our health plan has to go out and competitively sell against many other health plans and many other market elements out there. And then it has to have us deliver, or else we're going to end up having losses in our health plan, not just make money out of the hospital side and the clinic side of the business. So we are excited to have it help keep us honest, to help us work on how to develop population health and techniques and tools. And it will be kept honest because it has a number of competitors in this market from numerous commercial payers in order to ensure that it's keeping its prices effectively low as it's out there competing. So it just will help us become a more integrated and effective system.
Overall, financially, how is Aspirus doing a year into the pandemic? Have you recovered from the impact of canceled surgeries and procedures from the beginning of the crisis?
The organization has done a very effective job of getting through the immediate crisis. As many healthcare organizations, we are assessing the fact that healthcare is changing. And by healthcare changing means some certain volumes will go down. That may mean people will look for care in different ways. And so we're already starting to say, how do we reshape our cost structure and some of the ways we do things in order to continue to stay financially viable so we can invest in our communities? And we're working towards that. So we've been successful, but we know that it's going to require change to maintain our success.
And can you talk more about that? I mean, what are some of the changes that you've made in the past year that you think will outlast this pandemic?
Well, I think one of the first and very interesting elements that we found is how do we keep care more local even than we already were doing? How does a critical access hospital do more than what it's usually thinks it can do? How do we utilize our home health more effectively and care for patients in a different way? How do we help end-of-life care more effectively? We've always, in our organization, and I know many healthcare systems, we want to make sure at every last step that we are giving that individual a chance to have a great life. But sometimes we have to realize that extra care is not helping that patient and that we need to figure out how to transition then to the next phase. And we started to learn we have to do a better job on that. So just in the care elements of being a system, we're really learning how we can continue to strive and do better. We also have learned how to use technology more effectively. One of the things that we found is when you go from 1,000 people trying to schedule getting a vaccine or getting a test to 7,000 people in a matter of a few days that all need to be processed and wanting to have their services, how do you use technology differently? You can't keep throwing more people and more money at the problem. How do you use technology where many other industries have people self-schedule, come in and fill out their paperwork? So how do we use our technology to have our patients help us take care of themselves in a way and help us serve them better? So we started using technology in many different ways, as well as obviously telehealth. When you're in a rural America and you cannot drive very far, how can we use technology to provide telehealth services? And that will put a small plug in on my end of anything we can do to continue to support broadband communication strategy in the state of Wisconsin is going to be an important part of a Wisconsin ability to provide virtual services, because as you get into rural Wisconsin, I live 5 minutes from Wausau and I have to use satellite internet. And anybody who has satellite internet, you realize that you're not getting that ease of internet access that the rest of the country is getting.
So following up on that, Matt, with telehealth, a lot of systems saw a big spike in telehealth use in the beginning months of the pandemic. For some systems that started to settle down then after that, what's the future of telehealth at Aspirus? Is this something you see continuing to ramp up? What role will telehealth play going forward for you?
Well, we are definitely excited that the pandemic allowed us to innovate, be creative, but it also gave us the ability to overcome some of the inertia, the concerns that the medical community may have about how to use telehealth. So now that we have overcome those things, we're starting to say, how do we strategically use it long term? Well, what's the right way to care for our population? And given the ruralness of our population, if we can get telehealth and virtual services up and running, we can provide even more services more effectively to a broad range of people. So we're very excited about it. And again, I think some of it's going to be in our concern would be it's going to be restrained by the ability of the infrastructure of the telecommunication systems throughout some of our areas for us to be able to achieve it at the level we want. But that's something, again, that's why I'm putting that plug in. That will be a good help if we could get it.
So you talked about at the beginning of this interview, you talked about the increased use of outpatient care and home health care that you utilize to help manage the surge in COVID hospitalizations this fall. Could you talk about what you see as the future of home health care for Aspirus and maybe overall in Wisconsin? I mean, do you see, as we hopefully eventually get beyond this pandemic, what do you see for home health? What do you see for the future of home health?
I think home health is a huge opportunity for Aspirus, but it's also for America. When you look at the pandemic, it really showed the challenge that we're going to have as our baby boomers age. There's not enough skilled nursing facility, assisted living facilities. There's not enough physical capacity and people. And now I think some people realize it maybe isn't the best type of environment for everybody. It's a good environment, but it may not be the best environment for everybody. And we may not have enough ability to put all of the people aging into those types of facilities. So, and also too, some people are going to want to live in their homes and age out in their homes. But given the mobility of this country, not everybody's going to have a family to help them do that. So home health and help at home services and services that provide people the ability to age in place in their home are going to be a real big piece of care management in the future. And we're real excited to have a home health element to Aspirus, to have seen and tasted how it can work more effectively with our system through this pandemic. And so we're excited to continue to build on that, and we plan to over time.
So it's been a long year, and it's been especially a long year for frontline healthcare workers. What is morale like amongst your staff right now, and what steps are you taking to keep them going through all of this?
Well, I think the first and most important thing that we try to do as a system, from the day this started, March, I forget the exact day, but it was like March 15th or something like that last year, was to be transparent, open, and honest with our staff and our employees and our physicians. And at Aspirus, by April, we had told our organization that this was going to be a 2-year journey. We weren't sure, but we had kind of looked at the scenarios and said, most likely we're going to have a 2-year challenge here. We talked about when we thought a vaccine might be available, what normalcy might look like. So we truly felt that if we were upfront, transparent, and honest, people wouldn't feel that they were going to have the rug continuously pulled out from under them. And with the gap that we had in some of the areas of communication from external sources, we had to fill that gap. And we constantly try to fill that gap both internally and locally about the future we saw. Not to say we knew it was for sure, but we wanted to give people some understanding of what could happen. So we hoped to try to help people build the foundation for them to know that this was going to be a journey, a marathon, so they could pace themselves. We worked hard to make sure that we communicated that. We worked hard to get the staff that we needed to make sure they had the people that they needed. We worked hard to try to make sure we could get people back to work when they needed testing. And we gave a lot of different services that we could provide for resiliency and well-being, as well as a number of other HR things that we did with regards to pay, compensation, et cetera, to ensure that our employees felt valued through this process. But no matter how hard we do that, there is still going to be some challenge with regards to resiliency, the fact that people are worn out. It's been a long journey, and it makes it even tougher. And I give our team great credit. This announcement with Ascension was something that they're all excited about, but it's also something on top of something that they've already had to deal with. So we were really happy to see our organization and Ascension's organization embrace this acquisition and integration and partnership and go forward even during this pandemic, because people know it's going to be a tough road, and the pandemic's not over with yet.
What are you most optimistic about right now?
I am really optimistic about our ability as an organization, and I believe as a country, to get through this pandemic and to get through a lot of the challenges that we're facing in many other facets. We are a strong, resilient country. Our organization is a strong, resilient organization. And I'm excited after all we've been through and all we've been able to accomplish as an organization and as a country, that we'll get through these upcoming challenges that we face and come out of it better and stronger.
Well, Matt, thank you so much. We are unfortunately out of time. This has been a great discussion. Appreciate you taking the time for this. Thanks everyone for tuning in today, and thanks to all our sponsors for helping make today's event possible.
Thank you, Tim. I appreciate the time and opportunity.
Thanks.